Hi everyone, I am Gretchen Bailey with Optometry Times, and today I am joined by Ahmad Fahmy. He is the founder of the Twin Cities Ocular Surface Disease Symposium. Thank you so much for taking the time to talk with me today, Ahmad.
Of course, Gretchen. Thanks so much for having me. I appreciate it.
Oh, sure. I wanted to hear more today about one of the talks that you have called Neurotrophic keratopathy. Would you be able to give us a quick summary of your talk?
Absolutely. We're learning so much about ocular surface disease and how, basically we sort of, as a clinician, where we see most patients with many of the patients I see in clinic have some level of ocular surface disease. Our line in the sand really is that cornea. Once we start to see that corneal epithelium getting really beat up, we start to really react to that. So this talk is really focused on what is happening with the corneal nerve sensation and how that relates to ocular surface disease and the health of the ocular surface. So the communication between the corneal epithelium and neuronal cells in the corneal nerves is actually very critical for the maintenance of the blink and tear dynamics on the ocular surface. And so now we used to, think of these patients that have had some sort of disruption in that system as patients that we could, if they're having a persistent epithelial defect or something, or basically a non-healing epithelial defect, if we're able to get that epithelium to close down using some of the compounded medications, and they're left with a little bit of scar, boy, that's really a great success. We got that epithelium to close down. But what we're really looking at, we're on the frontier of basically treating that process before we have a big scar on those patients that is really can be visually devastating for a lot of patients. So that was the whole goal behind this talk, is to really refine our understanding of that interaction between a healthy ocular surface and corneal nerve sensation, and where we identify some of the main causes that can disrupt that important relationship, and then how to treat it effectively. And so there's a lot of excellent new advancements and treatments in this area, and the realization that patients that we are probably seeing every day in clinic might probably have this condition, but they might be misdiagnosed or underdiagnosed. And the biggest example of that, of course, in the optometric clinic, is the diabetic patient. We know that a lot of patients that suffer from diabetes might start to develop what we've maybe called diabetic dry eye or something like that in the past, but really understanding that there's something not right with the corneal sensation of some of these patients, and the importance of doing a very simple test, which is the cotton wisp test, in clinical practice, can really help you identify some of these patients. So those are some of the main things that we talk about in that lecture.
You mentioned a minute ago new advances in treatments. Can you give me a little bit more information about that?
Yeah, and I the main thing is that there have been some studies that have been very favorable in examining human nerve growth factor used topically when patients have a non-healing corneal epithelial defect. And so over an 8-week period, we now have a topical medication that's very effective in closing down most of those non-healing epithelial defects. And so if we can have that healthier relationship between the corneal nerves and the corneal epithelium, you find that the surface is rehabilitated faster. And that can be very important for some of these patients that otherwise really just might end up with a tough scar that might need more aggressive surgical intervention to get them seen better.
That's a great point. Fabulous. Thank you so much for taking the time to talk with me about this today.
Of course. Thanks so much for having me, Gretchen.